Health Check is brought to you locally by Island Cancer Center.
Strep throat is something that we on the island, unfortunately, are way too familiar with. I had it when I was 9 years old. That was an interesting year because I had it every single month for 11 straight months. You're actually saying that the problem is very gravely serious these days. So, explain like how bad it could get.
Excellent. So thanks for having me on again. I really am passionate about this topic. So I've noticed since coming to the island, I've had at least 8 patients with rheumatic heart disease. And allow me to explain how rheumatic heart disease is tied to strep throat, because everyone thinks that a strep throat is something you could kind of slug through and get done with, and it's okay and it goes away. And to some extent, that's correct. The bacterial component, that what actually makes your throat sore, is going to go away. What doesn't go away is your body's immune response to that, and that's what causes the rheumatic heart disease. So what happens is your body designs antibodies to fight off that bacteria. Those antibodies cross-react with the tissue in your heart valves. They also can cross-react with the tissue in your kidneys. It can cause severe damage to your kidneys. It can cause permanent damage to your heart. It most commonly targets your mitral valve and your aortic valve, but it can also target your pulmonic and tricuspid, and I'll explain where those valves live. So
we've all got a copy of Grey's Anatomy.
Yeah, doesn't everybody?
Yeah.
So
it's cool when you lift those different layers and everything you see.
Yes.
I used to love doing that.
Yeah, it's super fun. So those valves are essential for allowing one-way flow through your heart, and that's the way it's designed. Your heart's meant to be a one-way pump, and that's the only way it pumps efficiently. And so the blood comes from your body, goes to the right side of your heart, goes through your tricuspid valve, through your pulmonic valve, to your lungs, and then back to your heart on the left side through your mitral valve, and then out through your aortic valve to send oxygenated blood through your body. So that's kind of the course it takes. Any of those valves, if they leak, and that's what happens in rheumatic heart disease for the most part, sometimes they get stenotic and tight, but they leak. So that makes every heartbeat have to pump again to move that blood forward, if you follow me. So when it pumps, blood goes forward, blood comes back, and that same blood it pumped forward, it has to pump forward again because it all some leak back through that valve. That sets you up for heart failure. And so that's kind of the behind the scenes part of it. But what does this actually mean to Guam and the Pacific Islands? The Pacific Islands have the highest rate of rheumatic heart disease in the world. Between 280,000 and 344,000 people a year are dying from rheumatic heart disease. 45 million people in the world are struggling with side effects of rheumatic heart disease. That's how big of a problem this is. Like I said, I've noticed already in 6 months I've been here, 8 patients with rheumatic heart disease. In the States, just for comparison, I had 0. So it's tons of people here. Strep throat, just like you had it every month. My own family, when we got here, we all had strep throat multiple times. It's really prevalent on the island.
And is that a condition of the fact that we've got a certain climate here and strep throat is incredibly contagious, but some people still subscribe to that old school thing about oh, well, my mom was a teacher for her entire career, right? And she said, I don't know why some people fanaticize so much over perfect attendance, because it really does nothing for your college application for people to care about that thing. But more importantly, people that are genuinely sick are bringing this to a classroom full of classmates and a teacher.
Yeah.
And they're spreading that kind of thing.
Yeah. So I think it's a combination of a lot of things. There's a lot of dedication to your work in school on the island, which is awesome. There's a lot of strength and resolve among the people that if I can get through this, I'm going to get through this no matter what. And I think part of it is they just don't realize that there's a negative potential consequence for the rest of their life if they ignore these symptoms. And then I think it is a little of the climate. I think it is a little of the environment, and it may even be more complex than that. It's only certain strains of the strep that can actually cause the rheumatic heart disease, and it may be that those strains are prevalent on the island, and I would love to get some research done to find that out. I don't know when that's going to happen, but that's a goal.
Now, your colleagues in dentistry have, over the years, and we've done stories with them, they've also said that, people don't realize that gum disease can also lead to very lethal heart disease as well, and they really try and drill that home. They're like, okay, your breath smells kind of funky, you have teeth aches and everything like that, your gums begin to recede. That can actually kill you.
It totally can, but that's a different mechanism. So that inflammation that's chronic in your jaw goes to your heart through all your arteries, and it actually causes inflammation within those arterial walls that causes buildup of plaque. And so that's what leads to heart attacks. So that's a different causation than strep throat, which is your own body's immune system attacking your heart. And it'll re-attack your heart every time you get strep throat again, or a strep skin infection. So it's really important if you've had rheumatic heart disease that you stay on antibiotics so you don't get another strep infection, because every strep infection is going to add to the burden of disease in your heart.
Generally, when you see, especially like young people when they come in and they have strep, how serious is that, and how serious should the family like take that? Because if it's like, oh, mom, you know, like the glands are all swollen and they're like, you know, they say and obviously you've got, you know, white splotches and everything like that. The physicians like yourself have to take a throat culture and everything. How serious should parents be treating that?
They should be taking it very seriously because of the consequences. It's the strep throat itself, again, not a humongous deal in and of itself. It's the rheumatic heart disease and the glomerulonephritis, the strep kidney problems that come along after it. The strep kidney problems tends to be harder on adults, especially if you have alcoholism or other underlying chronic conditions. It can be fatal. I heard one study said up to 50% of people that seemed a little high, but it can definitely cause kidney failure and lead to progression in kidney disease and cause you to end up on dialysis because you ignored a strep throat, which, man, that's a hard consequence for something that seems so mild, right?
Are there any lifestyle changes that we can make that would make us less susceptible to rheumatic heart disease?
So just taking care of the strep throat. If you get antibiotics in the first 2 weeks, you avoid it. So if you have a sore throat that goes on longer than a week and you're not sure, go see a doctor. If you have that nasty red throat and it's really hard to swallow, see a doctor right away. Don't even wait till the week is up. But you have that 2-week golden window where if you get treated, man, you're saved. You don't have to deal with any of the consequences. And if you don't ever get the rheumatic heart disease, then you don't have to deal with those heart valves for that reason, at least. And your valves are meant to last 100 and some years.
Okay, now for the sucky part, right? For those of us that really still believe in like home remedies and everything like that. I mean, if we get the throat culture, we get the antibiotics, we have to stay home from school or work, whatever. What are things that we can do to ease the ache of like what are nasty sore throats? Because strep, again, I got it, I got it 6 times in a year. Those were not fun times and everything. So do we go with like ice cream, popsicles, hot soup,
So whatever makes your throat feel better, as long as you get the antibiotics. Saltwater gargles are good. Some people tell me they like hot sauce. Some people tell me they like ice cream. Usually if you get the antibiotics on board, the sore throat goes away in a day or two. Ask your physician if you're really sore. There are things we can prescribe for you to numb your throat up or help take away the inflammation and make you feel better sooner. Ibuprofen's not a bad choice as long as your kidneys are okay, or Tylenol, as long as your liver's okay. Those are things you can do too to help relieve some of the pain. But again, pain is a symptom. We want to take care of the underlying cause, that strep pyogenes bacteria that is messing with your immune system and going to cause you problems.
Health Check is brought to you locally by Island Cancer Center.